Blackheads that reform every week? Pimples that follow them? You don't need harsher scrubs. You need a three-phase clear method. Melt, lift, lock. Let's clear pores gently and keep them clear. We begin with phase 1. Melt. The goal here is to gently prepare your skin for a deep yet non-aggressive cleanse. Start with 3 to 5 minutes of gentle steam. You can use a facial steamer, or simply a warm damp towel laid across your T-zone and jawline. This initial warmth is crucial. A quick safety note: the towel should feel comfortably warm, never hot. Test it on your inner wrist first. We want to soften and relax the skin, not cause irritation or heat stress. This isn't about opening pores, a common myth, but about making the hardened sebum inside them more pliable. For an optional boost to your steam bowl, you can add a bag of green tea, which is rich in antioxidants that help calm inflammation. Alternatively, a single drop of tea tree oil can offer antibacterial benefits, which is great for blemish-prone areas. The purpose of this step is to soften the oxidized, hardened sebum and loosen the keratin caps that form blackheads. This preparation ensures that the following cleansing steps can work effectively, allowing for effortless removal without force. Now, for the first cleanse. Apply an oil-based cleanser to skin. Massage for a full 60 seconds, focusing on the creases of your nose, the sides of your nose, and your chin. The principle here is, like dissolves like. The oil cleanser will dissolve makeup, sunscreen, and your skin's own excess sebum. Next, add a small amount of water to your hands and continue massaging. You'll see the oil emulsify, turning into a milky liquid. This is a critical step that ensures the cleanser and all the dissolved impurities rinse away cleanly, leaving no residue behind. Then, rinse thoroughly. Follow with your second cleanse for another 60 seconds. A gel or foam cleanser with salicylic acid, a BHA, is excellent for sweeping inside the pores. If you're sensitive, look for gentle alternatives like heart leaf or green tea extracts, which cleanse effectively without stripping the skin. Pay attention to how your skin feels after rinsing. If it feels tight, squeaky, or uncomfortable, that's a sign your cleanser is too harsh. This tightness indicates barrier stress, meaning your skin's protective oils have been stripped, which can lead to more irritation and breakouts. If this happens, switch to a gentler pH-balanced formula. Your skin should feel clean, soft, and hydrated, perfectly prepped for the next phase. Phase 2 is lift. Here we clear out what we've softened using targeted chemical exfoliation. For congested blackhead-prone zones like the T-zone, we use beta-hydroxy acids or BHAs. Being oil-soluble, BHAs travel deep into pores to dissolve waxy plugs. Apply a 0.5 to 1% solution 2 to 4 times a week in the evening to clear pores without irritation. For more sensitive areas like the cheeks, where the goal is surface smoothness, we use gentler acids like PHAs, LHAs, or lactic acid. Their larger molecules work on the surface, reducing the risk of stinging. Use them 1 to 3 times a week to maintain a polished texture. Next, a targeted mask helps draw out impurities. Mix a base of kaolin or bentonite clay with a pinch of fruit enzyme powder and activate it with cooled green tea. Apply this paste only to congested areas. The crucial step is removal. Rinse when the mask is about 80% dry, matte but still slightly tacky. Letting it crack will dehydrate your skin. The result is a refined texture without tightness. For any obvious, ready-to-release blackheads, you can perform gentle extractions. Only do this after prepping the skin. Sanitize a comedone extractor or wrap your fingers in tissue. Position your tool beside the pore and apply gentle downward pressure with a slow rocking motion. If the plug doesn't glide out easily, stop. Forcing it can cause inflammation or scarring. And for whiteheads? Never pierce the skin. Simply apply a hydrocolloid patch overnight. It will gently draw out fluid and flatten the spot without breaking the skin. After any extraction, aftercare is critical. Dab the spot with a salicylic acid toner to disinfect, then glide an ice cube over the area for 30 seconds to calm redness and reduce swelling. Now, we lock in the results. After the lift phase, your skin is receptive, but also vulnerable. The first step is to immediately calm and hydrate. A soothing mist or toner is perfect for this. Look for ingredients like Centella asiatica, also known as cica, to rapidly cool redness. Heartleaf is excellent for rebalancing, and panthenol, or provitamin B5, acts as a humectant to pull moisture back into the skin. This step isn't just about feeling good, it's about restoring your skin's equilibrium and prepping it for targeted treatments. Next, Address your specific concerns. If your T-zone is oily or congested, a niacinamide serum at a 4 to 5% concentration is your ally. It works to regulate sebum production over time, which helps refine the appearance of pores and strengthens your skin barrier. For any red reactive spots, especially after extractions, a thin layer of azelaic acid is brilliant. It gently reduces inflammation and helps fade post-inflammatory marks, promoting a clearer, more even skin tone without being overly harsh. Moisturizer is non-negotiable. It seals in your treatment serums and provides essential hydration. Opt for a lightweight gel formula, especially if you're prone to congestion. Ingredients like hyaluronic acid and ceramides are key. They hydrate and reinforce your skin's natural barrier. A pea to nickel-sized amount is all you need for the full face. Properly hydrated skin produces less rebound oil and helps pores appear smoother and less prominent. Finally, the most critical step for daytime: sunscreen. Every single morning, apply a non-comedogenic formula with at least SPF 30. UV exposure is the #1 enemy of progress. It not only deepens the appearance of dark marks and scars, but also slows down your skin's natural recovery process. Think of it as your daily insurance policy. And remember, for it to be effective, you must reapply it throughout the day, especially if you're outdoors or sweating. This final lock ensures all your hard work is protected. Night A. BHA on mapped zones, soothe, gel moisturize. Night B. Retinoid adapalene pea-size, soothe, moisturize, clog prevention, plus texture. Night C. Recovery, no strong actives, hydrate, plus barrier care. Don't stack retinoid plus strong acids, plus benzoyl peroxide in one night. Pillowcase 2 to 3 week, wipe phone daily, cleanse within 10-15 min post-workout. Clean makeup brushes weekly, avoid heavy occlusives on T-zone. Hands off, if you want to touch it, patch it. "48 Hers, calmer redness, flatter bumps. 7-10 days, smoother nose, chin, fewer new plugs. 4 weeks, visibly reduced blackheads with BHA plus retinoid rotation and weekly enzyme, clay reset. Drop A if you're running the melt, lift, lock method tonight. Comment your skin type plus toughest zone, and I'll pin a tailored mini-map. Like, share, and subscribe for barrier-safe routines that actually work.